I have the pleasure of introducing Dr. Devin Oller. He is a primary care and addiction medicine physician and served as one of the first rural leadership fellows and chief resident at Massachusetts General Hospital before coming to UK. He is an associate program director for the University of Kentucky Internal Medicine Residency Program, an investigator for the NIH-funded Healing Community Study, and he manages KY Open. Welcome, Devin. Or Dr. Oller, excuse me.
Either works, to be honest. It's a pleasure, as always, talking with you all. As John mentioned, this is going to be a workshop. There's going to be lots of participation, so get ready for that. But this is the only way that we build on those great motivational interviewing skills that are going to help our patients and clients. I'm going to share my screen and we're going to jump into it. Okay. No financial relationships to disclose. So practice gaps and needs. Big gap is that motivational interviewing is an evidence-based approach to promote behavior change, but how it's best implemented and maintained in an everyday clinical practice where you're busy is not often clear. And our big need is that understanding and implementing MI skills can help providers, clinicians promote behavior change and outcomes for people with substance use disorder. Our goal today is to review some of the key strategies and skills of motivational interviewing, practice those skills, and see how they can be deployed in conversation with people who use drugs. And also some best practices for integrating this into your own workflows. I hope that you come away being able to utilize these patient-centered skills to help elicit and strengthen folks' motivation to change. So I'm going to provide a little bit of an overview, but again, the bulk of this is going to be working together through some of these skills and strategies. So before I talk about these strategies, let's just lay out some ground rules. Number one, do not use motivational interviewing on your spouse or significant other. I have been called out on this before. My wife said, please stop motivational interviewing me. So just don't do that. But along those same lines, motivational interviewing in the true spirit of it should really be to try to guide patients or clients to understanding sort of their own motivations for changing behavior. This is not imposing your will or your structure of how somebody should seek recovery. And that's where it works the best, is when we are sort of checking our assumptions, our biases at the door. But these are some general things that can help you as you're navigating motivational interviewing conversations. You always want to express empathy. Communicating with respect and acceptance is huge. Establishing a non-judgmental collaborative relationship. And sometimes you have to do that before you jump into motivational interviewing. That person has to trust that you have their best interest at heart when you start to sort of push against some of the rigid ideas that they might have developed about themselves and their own motivations. We want to be as much as possible a supportive and knowledgeable consultant. Unlike today's presentation, when you're doing motivational interviewing, you should be listening more than you're talking. Developing discrepancy between clients' goals and the values that they are stating to you and their current behavior often is a strong way to start to elicit change talk and begin to get folks interested and invested in making that change in their life. You want at all costs to avoid argument, and that includes having the client begin to argue against the changes that they know are best for them. When you're hearing resistance to change, you want to roll with it. You want to support that individual's self-efficacy, share hope, share optimism that things are going to get better. So those are overall strategies, but what does that actually look like in conversation? So when I talk about motivational interviewing, I like to make this analogy of you're with a client and you guys are sort of in the same boat, okay? And one way of getting that boat to its destination, getting somebody in long-term recovery and remission from their substance use disorder would be for you to sort of set up a sail and you have control of the rudder, and you send that person in the direction that you think is best for them. And that works for some clients. It's hard not to acknowledge that. But for many people, like, that's just not how we as humans respond to making really big changes in our life. We have to find a reason to make that change. And so what we often use is OARS. So the client has control of sort of the direction that they're going in, but we're giving them sort of the tools to do that, and slowly but surely helping them guide in a direction that's most important to them. So what are OARS? These are the skills for motivational interviewing, and we use this again and again and again. If you're getting lost in these conversations at all, just remember OARS. So these are open-ended questions, affirmations, reflections, and summarizations. I'd say this is a little bit out of order in terms of how often you're using each of these. I use reflections probably the most in our conversations with patients. Open-ended questions probably second. Affirmations, summarizations, a lot more rarely. But all of them are really useful skills to start to develop now so that you can improve the care of the clients that you're taking care of. Open-ended questions, just to define that, it can't be answered with a single word or phrase. So rather than asking, do you like to drink, which could be replied with just a simple no or yes, ask what are some of the things that you like about drinking. Affirmations support and sort of comment on that client's strengths, their motivation, their intentions, and the progress and the effort that they've put in to change. Reflections we'll dive into in a lot more detail in some of the exercises to come, but they're demonstrating that that client is being heard and you're trying to understand where they're coming from. Summarization often allows you to provide some clean transitions, allows you to emphasize the change talk that has already been brought up by the client, and sometimes can be used to steer the conversation away from more problematic resistance. Okay, so just as an example of open and closed-ended questions, these are pretty obvious, but what you can do as I'm going through these and reading them out is think about sort of what the open-ended question version of the closed question you would use, right? So there's this closed question of, so you are here because you are concerned about your use of alcohol, correct? Which they could easily respond to with a no, and that's the end of the conversation, right? Versus tell me what it is that brings you here today. How many children do you have? I can answer that question with one. An open-ended question would be, tell me about your family, right? Do you agree that it would be a good idea for you to go through detoxification, right? So again, this is sort of putting them into a corner where either they have to say yes or no, and sometimes they might be a little bit ambivalent about making that next step. So asking, what do you think about the possibility of going through detox or withdrawal management, right? First, I'd like you to tell me some about your marijuana use. On a typical day, how much do you smoke, right? Tell me about your marijuana use during a typical week, right? Allows things to be a little bit more broad, allows them to begin to discuss how, like, the reasons that they might be using cannabis products. Do you like to smoke, right? Again, yes or no question, versus what are some things that you like about smoking? Again, tapping into motivation to maintain current levels of use versus motivation to change that use pattern. How has your drug use this week been compared to last? More or less or about the same? It's a multiple choice question, right? Which can sometimes be effective in these conversations because you want to move patients towards an answer and a way that you might be able to help them. But often, as we're beginning to form that relationship, you're going to want to ask questions like this: what has your drug use been like during the past week? And there's a few more examples here. I will leave this up here, and you can always go back through these slides if you want some help sort of differentiating the closed and open questions, but pretty straightforward. Affirmations. So that's open-ended questions. Affirmations. So when you are listening to the client, I want you to listen to not just the struggles that they're dealing with, but the strengths that they are bringing to bear. So what are those strengths? How would you want to acknowledge those strengths, right? Um, that's so important in motivational interviewing, because what affirmations build is that client's sense of self-efficacy, that they have control over their life and the decisions that they're making with regards to their substance use, right? And so the more we can highlight, hey, you are a really strong mother to be able to navigate all this, and maintain your relationship with your kids, right? Or you sound like a really hard worker, right? When somebody's sharing concerns about how their work schedule might conflict with getting into an intensive outpatient program, right? It sort of shifts the gears, and allows the client to argue less in favor of maintaining their current use, and more in favor of potentially changing up or reducing that use. So some examples of affirmations might be like, I appreciate how hard it must have been for you to decide to come here. You took a big step. Or, I think it's great that you want to do something about this problem, right? Even if that something might be really, really small and something that we might not agree with, acknowledging that they want to make a step can be huge. You're certainly a resourceful person to have been able to live with this problem this long and not fall apart, right? Or that's a good suggestion. One of my favorite affirmations these days, in folks who are using opioids, is the supply of heroin slash fentanyl out there has been crazy. And if somebody has navigated the last year or two without overdosing, they're doing something right, whether that's test dosing or using less, for that first initial use, to make sure that their supply is okay, or using fentanyl test strips. And so just acknowledging that, I often see a shift in the conversation, where it's less sort of back and forth, and more of a collaborative thing of us trying to work together to see how we can further improve their health. So that's affirmations. Reflections. We're going to talk a lot more about reflections when we go through an exercise in a few minutes here. But I often talk about sort of a rainbow of reflections that you can use when talking with clients, especially with clients who might be showing some resistance to making a change in their substance use. Reflections come in two basic flavors: simple or complex reflections. Simple reflections are simply a response to resistance with non-resistance. Example of that might be, you don't think abstinence would work for you right now, right? Complex reflections actually change a little bit of either the meaning or the tenor of what the client was telling you. So an amplified reflection sort of exaggerates a little bit what the client just said, and what it allows them to do is argue against just stasis, right, or staying the same. So example might be, if a client is saying something like, my wife keeps on nagging and nagging me about trying to cut back on my alcohol use, you could say, sounds like your wife is worrying needlessly, right? And they might say, wait, no, I didn't mean that, right? I know she's concerned about me, right? And then we're starting to talk about sort of the why the wife is concerned, rather than him or sort of justifying his ongoing use as a response to sort of the quote nagging, right? Double side reflection. So this is where you juxtapose the client statement with a prior statement that might counter it, right? So acknowledge what they're saying to you in the moment, while also acknowledging something that they might have brought up before. You can see some problems here, but you're not quite ready to think about quitting right now. A double side reflection is often used with sort of the stem, on the one hand, fill in the blank, and then on the other hand, right? It allows them to see both of those things can be true. Shifting focus reflections. So that might be, if they're really sort of focusing too heavily on specific barriers or obstacles to change, and you're starting to feel like, hey, we're just arguing at this point. We can shift focus by saying, it sounds like we're not ready to talk about making a change right now. I'm still trying to understand your priorities or what's important to you, right? So it just turns down the temperature in the room a little bit. Agreement with a twist, right? So they might say something that might be in support of continuing in the same direction, and you agree with part of that while beginning to shift into a new direction. And that's similar to reframing, where you offer a new or positive interpretation of negative information. Like, sounds like your spouse really cares about you, for the comment like we were talking about before. Okay, so those are reflections. And then lastly, summarization. So oftentimes, one exercise that I'll do is I'll divide sort of a piece of paper in half, and say, hey, let's go together and think through some of the pros and cons of continuing to use at our current levels, right? And they'll often be able to generate a pretty long list. And then it becomes a great opportunity for you to summarize in a way that highlights the really important things about the list, and maybe highlight some of the motivations that they have to reduce or stop their use. So you can always sort of circle back to this slide later and try to think about how you would summarize these pros and cons. But I think this is a really important skill as well. We don't use it as often in motivational interviewing, but still very critical. So those are the basic skills, and we're going to practice those today. One other skill is being able to listen to and recognize change talk versus sustained talk. I've alluded to this a couple of times already, but change talk is basically anything that the client or patient is saying that suggests that they might want to make a change to their current level of use, right? That might be highlighting an internal motivation. It might be highlighting an external motivation. So something, family, legal, financial issues that might be nudging them towards making a change. On the other side is sustained talk. Sustained talk is anything said by the client that sort of points towards wanting things to stay the same, to not change, right? And these are some examples of this. I'm not going to go through all of these, but a couple important ones to highlight. So, like sometimes when I've been using, I just can't think or concentrate, right? So when we hear change talk like that, we often want to respond to that with a reflection that highlights that change talk, right? So something like, it can be really hard to concentrate when we're using at this level, right? Often just sort of rephrasing what they just said can be really important to highlight that. On the other side, you see things like, no way am I giving up Coke, or I'm not going into the hospital. I've tried to quit. I just can't do that, right? And when we hear sort of what sounds like hard stops, not going to do anything about this, again, our job is to roll with that resistance, right? So often, again, reflections might be a good way to acknowledge that, or even open-ended questions, right? So somebody saying, I'm not going into the hospital, we could open that up to saying, tell me a little bit more about your concerns about making that step, right? To see really sort of what is the main motivating factor for them saying that. And change talk can further be sort of categorized into these 5 buckets. So desire, reason, commitment, ability, and need. And often that change talk starts with certain stems. So somebody expressing a desire to change might say something like, I want to, or I wish, or I'd like to. So when you're hearing those specific words, listen even harder to think about what they're about to say next. A reason change talk is when they're stating, here's a really good reason for me to cut back on my use. Commitment. So when somebody says, I will, or I promise, start thinking about what that commitment might look like, and what might get in the way of making good on that commitment. When somebody's saying I could, or I know I can, that's really expressing ability change talk, right? Where they could see themselves doing it, but there might be some barriers that they're also identifying. And then need is when they are feeling some external pressure to make a change, right? And that's still change talk. We still want to acknowledge and try to understand better what internal motivation they might have. But when we're hearing I should, or I have to, or I need to, sort of phrases, we want to be alert to what those needs are. And when we hear any of this change talk, I want you to remember sort of these three open-ended questions, right? That are a great way to start to dive a little bit deeper into their motivation. So where does that leave you, right? Where do we go from here? What do you think you will do, right? Again, these are totally non-judgmental, very open, allows them to really sort of take the lead and steer that boat in the direction that they want to. But you don't want to just sort of leave the change talk unaddressed, right? And so this is a great way to jump into that conversation a little bit more. Okay. Any questions about the strategies, the OARS, or change talk? Let me pause here. Okay. Ready to just jump into exercises. Love it. Here we go. So the first one that we're going to do, it's one of my favorites, is the open-ended question snake. All right. So in this example, I'm going to act as a client. And I'm going to assign one person to come up with an open-ended question. Then they get to tag sort of the next person in the snake, who also has to come up with an open-ended question based on how I respond as the client. So they'll jump in with him, her, or his open-ended question after my response. And the snake starts over if a closed-ended question is asked. Okay. So I will give you a clue, right? So like why or how questions are often more likely to be open-ended questions than what, or other types of question words. And for this example, I will be a client who is coming in to see you about getting in for treatment for opioid use disorder. They're interested in Suboxone. They also struggle with some stimulant use as well. So I'm just going to randomly go down the list here. And why don't we start with Matt L. Matt, why don't you ask an open-ended question of me, the client, and then after you ask the question, you get to tag the next person who has to ask the question. So go for
Devin,
it.
can you tell me a little bit about what your Suboxone uses looked like over the past 3 to 6 months?
Sure. So I've been using Suboxone mostly just purchased from friends or however I can get it. And I usually use it when I'm struggling with withdrawal and can't find something, right, to help with that. And so that allows me to at least sort of get through that day and maybe get through a work shift and be able to, afford my usual supply the next day. Yes, he said Ashley.
Okay, sorry. You mentioned you get the Suboxone when you start going through withdrawals. What is it that you're withdrawing from?
From heroin. So Ashley, that was a little bit of a close-ended question.
Okay.
Yeah, but that's okay. Try again. So I think what you're getting at is sort of what their experience is like with the withdrawal, right? So can you think of sort of an open-ended question that gets at that a little bit more?
Kind of just what you just, so can you tell me your experience with your withdrawals?
Awesome. Yeah. So, so yeah, I mean, like these days, it's like just a couple hours after I use, like I'm starting to withdraw again. So if I'm not able to like get enough the day before, then by like the middle of the day, I'm really, really struggling. And so I'll just try to go out and find, like 1 or 2 Suboxone tablets. And then I have to wait because I don't want to make myself sick either. All right, you get to pick your next victim. Sorry, who did you pick, Ashley?
Meredith.
Meredith.
Hi. So sorry, my voice is going. So you mentioned your experience with withdrawal. Have you thought about doing anything different? Maybe trying any different medications or forms of treatment?
Yeah, so I think that's why I'd really like to get into a clinic. Like I'm just tired of the day-to-day grind of trying to get through the day and not be sick, and it's just exhausting at this point. Okay, tag your next person.
Let's do Danny.
Okay, thanks, Meredith. I understand that you go to the street and get what you need to keep yourself from getting sick. I know the feeling, not wanting to feel that way. So if you do get into a clinic, there's a lot of things that you have to do. You have to do counseling. You have to show up on a regular basis. So what roadblocks do you see possibly coming up, or barriers you see coming up that might stop you from achieving this?
Good question, Danny. So I feel like the biggest thing for me is going to be just getting the transportation. Right now, I have to like borrow my friend's truck to get to work and stuff. And so also having to borrow it to get to the clinic, or having to take the bus, like I just see that as a big hassle.
Okay.
All right, so why don't we pause there? So good job to volunteers. I appreciate you guys helping out with that. Maybe for others, and you can put this in the chat too, but what's challenging about open-ended questions? This isn't the easiest exercise in the world. It can be hard sometimes coming up with open-ended questions. So what makes it challenging? So one thing that I noticed is it can be hard to both listen really intently and while also trying to think of your next question. So sort of balancing listening and coming up with an open-ended question. What else?
We do have some answers in the chat. Are you able to see those, or would you like me to read them?
Yeah, go ahead and read them out. For some reason, my chat's not working.
Yeah. Let's see. Being able to say something that doesn't require yes or no. It's not typically like a normal conversation per se. 2 people said listening and being present and thinking of a question. Trying to not repeat the same type of questions. And then sometimes patients have word vomit, so I often struggle with where to begin or what to begin with, I guess. And then giving a client an open-ended question that will give us information but not make them feel like they're being put on the spot.
Yeah, so I'll rephrase that maybe as like a non-confrontational question, right? Yeah, so some tips for addressing each of these things that you guys highlighted, and I appreciate the responses. So in terms of balancing and listening and coming up with an open-ended question, one thing that can be really helpful is developing maybe like 2 or 3 questions that you can go to again and again and again, right? So the like, tell me a little bit more about fill in the blank is a great one to use, right? Or what do you see as that next step is another great one, especially when you're responding to change talk, right? And that's nice too, because if you're not hearing change talk, you can put that that question to the side. Not repeating ourselves, right? So the nice thing there is that you can repeat yourself a little bit, but if you find yourself, oh, I'm about to ask the same question, just mix it up with a reflection statement or a summary statement. You can come back to that question a little bit later on. So the patient's having word vomit. So this is the hardest thing I find, at least, about motivational interviewing, is if you're doing it right, you're not in complete control. The client is really leading that conversation, and you're helping them discover sort of their motivations to potentially make a change. But I will say, if you're noticing again and again and again after each open-ended question, you're not really getting a targeted answer, it may be helpful to sort of use a summary statement to highlight some of the key things that they brought up, and then really ask them, hey, you mentioned these 3 things. What do you want to focus on the most today, right? And we can always come back to some of those other issues at another time. And then a non-confrontational question. I will often add some language before I ask the question. Danny demonstrated this really well with his question. He sort of gave a reflection, a little bit of a personal piece on that client's experience going through withdrawal and having to get something off the street, leading into his question, right? So you can do the same thing of, I ask this of a lot of my clients because it's so common, unfortunately. But how often do you feel like you have to get something from somebody else to get through the day, right? So providing some of that normative language or upfront language of why you're asking that question can sometimes blunt any feelings of confrontation. So good job with that, guys. All right, so let's jump into reflections. You guys nailed the open-ended questions. Time to do some reflections. So what I'd like you to do is, if your first name is between an A and an H, you're in group 1. If you're between an I and a J, you're group 2. If you're between K and M, you're group 3. And between N and Z, you're group 4, okay? And so we're gonna go one group at a time, and I'm gonna flash a statement from a client up on the screen, and I want you to write out your reflection in the chat, like how you would respond to that statement. But I don't hit enter until I say so that your peers can't cheat and steal your reflection, okay? I'll pick the best reflection of the group, and then the winners in each of these groups will face each other in the final round. So we're going to do 4 preliminary rounds with 4 winners in each of those rounds, and then we're going to have a final, okay? So a little bit of a competition here. All right, so group 1. So people with a first name between A and H, get ready, turn on your reflection brain. This can be a simple reflection, this can be a complex reflection. Write it out in the chat box, and then I will tell you when to hit enter, okay? Here we go. So first group, the client says this: I think Suboxone is just trading one drug for another. I don't see how it helps anyone get better, right? So that the client just told you this, right? And so you're gonna come up with a reflection to respond to that. So I'll give you sort of about a minute. I think Suboxone is just trading one drug for another. I don't see how it helps anyone get better. And other people not in this group can start thinking about how they would respond to this as well. All right, I'm gonna ask you to hit that submit button in 5, 4, 3, 2, 1, go. Okay, so I'm gonna read these out. So I'm hearing you say that Suboxone isn't any safer than drugs that are available on the street. From Candy, I understand you think it's trading one for another. Many diagnoses require medications such as diabetes, heart disease. Danielle, I can see why you may think that, but could you also see how Suboxone helps like insulin helps with someone with diabetes? And Aaron says, I hear that you feel like Suboxone is trading one drug for another. So, so I like the sort of the question mark at the end of that. So I for the winner here, I'm going to choose candies, and the reason I'm choosing candies is because it's a simple restating, right? But with a slight tweak of I understand you think it's trading one drug for another. So it's acknowledging what they're thinking, right? And then what you do is you sort of you acknowledge that at the same time add in sort of this other thing for them to think about, right? And you could even open a question to that of, you know, hey, many diagnoses require medication such as diabetes or heart disease. Do you think addiction is a disease like that requires treatment? And sort of go from there. So Candy, you advance to the final rounds. Congratulations. Group B. All right, so these are people with the first name between letter I and J. Okay, the client says this: I'm tired of chasing it every day. It's like a full-time job just to stave off withdrawal. I'm exhausted, right? So you're coming up with a reflection for this client. What are you going to say to them? Again, I'll give you about a minute. Just type it in the box, but don't hit submit yet.
Devin, was that the same group doing it again?
No, different group, different group. If
Okay,
your
good.
name starts with, your first name starts with an I through J.
Okay, thank you. Yeah, I submitted mine late.
That's all right. Okay, be ready to submit in 5, 4, 3, 2, 1, go. All right, here we go. So Jenny says, I can completely relate to everything you are saying. What are some steps you're willing to do right now to help with this problem? Any resources you would need? Are you saying you're ready to make some changes in your lifestyle to be more stable? Sounds like your substance use is really taking a toll on you. I've actually been there myself, and I would love to talk to you about doing something different if you'd be interested. I hear you're quite exhausted. The withdrawal symptoms seem to be extremely hard. So I think I'm going to give the winner here to Jamie. And the reason I'm doing that, Jamie, you did a great job here of really just highlighting how they're feeling, right? And especially highlighting some of the withdrawal symptoms, which seems to be a main motivation that they're making these statements of feeling like they need to make a change. We can dive into those symptoms more, but in the moment, I think saying something like what Jamie is saying would be most helpful in moving that conversation forward and generate more change talk from the client. So congrats on that. Okay, group C. These are for people with the first name between K and M. All right, I've overdosed a few times this year. I don't know why. I just worry a lot about when I'm going to get anything next. And so I use what I have and hope it lasts. Okay. So how would we respond to this statement with a reflection, either a simple reflection or a complex reflection? So I'll give you guys a minute. While you type it out, don't submit quite yet. One thing probably that you guys have already noticed is sometimes simpler is better with these reflections, because it's less likely to interrupt the flow of the client talking about wanting to make a change, right? And I think that's a really critical point, is it allows the balance of the conversation to be mostly that client talking and less you talking. We've all been in that situation where we feel like it's like pulling teeth to get information out of someone. In a motivational and interviewing conversation, it shouldn't feel that way. And we want to do everything we can to ease their comfort in sharing. So for this group, maybe take 20, 30 seconds more to come up with your reflection. Get ready to submit in 5, 4, 3, 2, 1, go. All right. So we got Matt and Mackenzie duking it out. Man, I'm glad you're still here to have this conversation with me. Can you tell me a little bit about how you were using when you overdose? And Mackenzie says, I see you're concerned about your supply. That can be scary to not know if and when you'll get your next supply. Yeah, Mackenzie, I think, is the winner here. I think that's nice and concise. It's talking about their main concern, which is their supply. It provides an entry into maybe discussing more the safety of that supply, and how that might be contributing to their overdoses. So really excellent job. And group D, rounding things out, last one before the finals here. I don't think I need anything to get sober. I appreciate you offering help, but when I'm ready, I can stop on my own. Okay, so how would we respond to this client? I think you're already noticing reflections are really, really good when clients are expressing some ambivalence or even some outright resistance to making a change to reduce or stop their use. And so we want to be able to highlight sort of the why behind these statements, while also moving them in a direction where we can build our relationship and break through some of that resistance. So this is for folks with first name between N and Z. Go ahead and type out your reflections. Give you 30 more seconds. And then we'll submit together. All right, get ready to submit. In 5, 4, 3, 2, 1, go. All right. So Shirley says, thank you for allowing me to speak to you today. Is there any harm reduction things I can supply you with? Maybe a syringe exchange. Love it. I hear you're saying that you don't feel as if you need medication. Would you like to discuss what possible options may be in case you decide later to pursue that? You aren't ready to stop using. You feel like you can stop on your own when you are ready to do so. Rebecca says, I completely understand that what you're saying, but just know I'm here if you change your mind. I hear you saying you can stop when you're ready. We're here if you ever need additional support. This is a tough one. You guys, I think, did a really nice job of highlighting sort of how they're feeling in that moment of not wanting to make a big jump here. For me, I think that probably Samantha's rises to the top here. It's a nice juxtaposition of that acknowledging where the person is and acknowledging how you can provide additional support in a non-judgmental way. So we're going to move you onto the final. So Samantha, Mackenzie, Jamie, and Candy. Here we go, guys. Final round. This is a tough one. This is a whammy. This is a waste of time. I don't know why I'm even talking to you. Me using heroin is not the problem. If my doctor would just prescribe me the pain medications I need, I would be fine. All right, so how would we respond to this client? Go ahead and give you guys a minute. Go ahead and type out your responses. I want the rest of the group who haven't quite made the finals, and that's okay, to think about how you would respond as well, because this is a really hard one. All right. Hopefully we're rounding things out. Get ready to submit. In 5, 4, 3, 2, 1, go. All right, here we go. Let's see what our finalists say. I understand it might be frustrating and costing extra time to talk with me. It does seem that a prescription would be a quick solution. Ooh, that is next level. So let me break down a little bit of what Mackenzie is doing, right? So she's highlighting sort of how the client is feeling like it's a waste of time, right? So it's acknowledging, hey, every conversation costs a little bit of extra time, right? And that a quick solution to this issue would be a prescription from a doctor. And it's sort of leaving that open door of like, what if that isn't the solution, right? But she doesn't say that. She just sort of allows that to sit with the client. So Jamie says, what would be worthy of your time? Have you tried Suboxone or methadone? Those are legal prescriptions that would help you be healthy, right? So offering some other options. Jamie says, I hear you're experiencing pain and that is your biggest concern right now. So I like this as well. So highlighting how pain seems to be the main source and motivator for ongoing use. And maybe by saying it this way, sort of relieves the client of that sense of, okay, we're only talking about heroin here, right? And that might be why they're pushing back. Candy says, I hear that you're using heroin for pain management. You need more care. Can we look into other options? And Samantha says, I understand you're not sure why we're talking and that you're in pain. So similar to Jamie's. This is really tough. You guys all did a really nice job. I'm gonna give the window to Jamie. I think it's the most straightforward. It allows us to highlight the main concern that the client has and maybe help with that a little bit. So big round of applause for Jamie. But you guys did a great job all around. All right. So in reality, reflections are going to be tough to come up with much more quickly, but hopefully by doing this and seeing how other people are responding, you can steal a couple of phrases that were really helpful and powerful, and maybe use that in your own conversations with clients moving forward. All right. I'm actually going to skip over this exercise just in interest of time and jump to our decisional balance. So we talked about this a little bit earlier. The decisional balance exercise is where we go through with a client the reasons that they have currently to reduce or stop their use or sustain their current level of use, right? And sometimes in the health profession field, we can be uncomfortable with talking about the positives of ongoing use, right? Because it's just ingrained with us and it's so stigmatized that around that substance use. But it's really important when identifying motivation that we understand motivation both to reduce use and also to sustain use. So we do this decisional balance where we might tell a patient, hey, I'd love to hear a little bit more, some of the reasons you feel like heroin or alcohol is helping these days, right, to get through your day. Or some of the reasons you feel ready to reduce your use, right? But oftentimes that first go through with clients, they might have maybe like one or two things on either side of this balance scale. And so you can sort of nudge them to come up with more reasons for and against their current level of use. So that's what I'm going to ask you guys to do together here. I'm going to have basically everyone with their first name from A through J on team 1 and K through Z on team 2. And what we're going to do, don't do anything yet, but when you go, when you have see the menu bar on your Zoom screen, there should be available to you the option for annotate. And you can hit the annotate button and then text, and you should be able to type something on the screen, like withdrawal, right? So can folks see the annotation? Been able to find that? Okay. Let me just check the chat real quick. Okay. So team A through J, you guys are going to type motivations to decrease or stop use. And team K through Z, you're going to write as many motivations as possible to continue their current level of use. And this is a client who's using heroin or fentanyl. Okay. And I'm going to give you guys 1 minute. Ready, set, go. So you're going to hit the annotate button and then text and then type in your responses. We're neck and neck right now. It's a close one. We got 10 more seconds. 4, 3, 2, 1. All right. So so this is interesting. So motivations to reduce or stop use edge things out a little bit. So they had 1, 2, 3, 4, 5, 6, 7, 8, 9 versus 1, 2, 3, 4, 5, 6. But I think you came up with a lot of good ones, and each of these individually can be amazing discussion points to just talk with the client. Hey, can you tell me a little bit more about this? Or I'd love to hear sort of your perspective on what it's been like dealing with the pain, right? So on the left side, motivations to decrease or stop use, going into withdrawal, can't afford, having peers who have overdosed on supplies that I've also purchased, not knowing when fentanyl may be in supply, healthier relationships if I'm able to reduce use, the cost, avoiding jail, safety, strain relationships. So it's nice for the client to often see that there's often more reasons on that reason to, if we think about the scale analogy, there's more on that side to decrease or stop use. And visually that can be really, really powerful. But we do want to spend some time with them to try to come up with some of those motivations to continue use, right? So you guys had a couple of good buckets here. So physical pain and emotional pain, I think talking about those separately can be really important. And if they're just identifying physical pain, talking about how some people feel a lot of emotional pain that they can cope with when they are using, right? The bucket of sort of the social aspect of use, right? So if folks sort of social relationships are all tied to using, then of course it's going to feel like a big leap to separate from those friends, or make an attempt to reduce use when friends are not, right? And then the barriers to getting effective care, when balanced against not a lot of barriers to get your supply, can be a huge motivation to continue using. So beginning to talk through some of those barriers can be a good jumping off point. So this is a great exercise to practice with your clients. You take a blank piece of paper, divide it in half, say, hey, I want to go through this together so that I can better understand where you're coming from right now. We're going to talk about some reasons that you might have to decrease or stop your use, and some reasons to continue use. You can give them those two sides and have them fill it out, or you can fill it out together. But you want to reflect on each of these elements, ask those open-ended questions, use some reflection or summary statements to move that conversation along. So this is a great tool to use in your motivational interviewing conversations. And I am going to clear all these drawings that you guys are doing. That's fun. And we'll move forward. So I think this is a great time to pause, and we'll do a lot of other great activities next week as well, sort of advancing some of these skills and strategies. But let me just summarize a little bit of what we learned today. So there are many strategies that make for successful motivational interviewing. Probably the biggest one is accepting that many people come into these conversations with a lot of ambivalence. That's a part of the change process. In fact, many times I use motivational interviewing just to get somebody to the point of being ambivalent, right? And I see that as a win many times. Open-ended questions, affirmations, reflections, and summary statements, or OARS is your mnemonic for remembering the most important skills needed to navigate these conversations. The key goal of all the conversations is to evoke and highlight and support change talk. And we're going to spend a lot more time next week diving into how we respond and identify change talk. And if you find yourself arguing with the client, just stop, listen, check your assumptions about what you know, ask for more information, use those reflection statements to highlight the things that you're hearing from them. Because the key with motivational interviewing is that you want that conversation to continue, not just in that moment, but on future interactions with that individual. Many times it can take 4, 5, 6, 7 or more conversations to get to a point where we're seeing significant change talk or steps in the direction of positive behavioral change. But we've continued that conversation and we've kept them feeling comfortable and trusted their own motivations to get to that same place that we're trying to work with them to get to.